Cardiovascular adaptation. Blood, heart, and cardiovascular system work together as a unit. They respond to physical and physiological changes, such as exercise and blood loss, to maintain homeostasis. Vascular supply to specific regions. Some organs have separate mechanisms to control blood flow. Three important examples: the brain, the heart, and the lungs. Blood flow to the brain is a top priority. Brain has high oxygen demand. When peripheral vessels constrict, cerebral vessels dilate, normalizing blood flow. Cerebral vascular accident, CVA, is called a stroke. Blockage or rupture of a cerebral artery stops blood flow. Blood flow to the heart through the coronary arteries. Oxygen demand increases with activity. Lactic acid and low oxygen levels dilate coronary vessels, increase coronary blood supply. Epinephrine dilates coronary vessels, increases the heart rate, and strengthens contractions. Cardiovascular adaptation continued. Heart attack. A blockage of coronary blood flow can cause angina, chest pain, tissue damage, heart failure, and death. Blood flow to the lungs, regulated by oxygen levels in the alveoli. High oxygen content, the vessels will dilate. With low oxygen content, the vessels will constrict. The cardiovascular response to exercise. Light exercise. There's extensive vasodilation occurs, increasing circulation. Venous return increases with muscle contractions. Cardiac output rises in response to venous return. Frank Starling principle. Atrial stretching occurs. The cardiovascular response to exercise, heavy exercise, activates the sympathetic nervous system. Cardiac output increases to maximum, about 4 times resting level. Restricts blood flow to non-essential organs. Example, the digestive system, reproductive system. Redirects blood flow to the skeletal muscles, lungs, and heart. Blood supply to the brain is unaffected. Some interesting, this is an interesting table. Changes in blood distribution at rest and during exercise. So at rest, we're looking at that as tissue blood flow in milliliters per minute. The skeletal muscle at rest is 1,200. Light exercise, we go up to 4,500 milliliters per minute. Strenuous exercise, we go to 12,500 milliliters per minute. That's interesting. Wow. The heart, 250 to light exercise, 350 to strenuous exercise, 750. And here's something that's interesting. The brain at rest, 750 milliliters of blood. Light exercise, 750 milliliters of blood. Strenuous exercise, 750 milliliters of blood. That brain does not want to change, and it creates certain things, sphincters closing, etc., to where it stays the same. Skin changes, kidney changes. Oh, look at the kidney. The kidney at rest, milliliters of blood flow, 1,100. Light exercise, 900. Strenuous exercise, 600. Well, how can that be? We indicated that, let's go back up here. Where was it? Okay, heavy exercise restricts blood flow to non-essential organs. It's not essential as we start to exercise that our urinary system works. Therefore, we're shunting blood flow from the kidneys. The more strenuous, the less blood flow there is in the kidneys. Interesting. Abdominal viscera. Same thing. We're not using our digestive system when we're exercising. Therefore, we can move some of that blood supply away from the digestive system, or some of that blood flow. Total cardiac outputs. Neat little table. Okay, exercise and cardiovascular disease. Regular moderate exercise moves low-density lipoproteins from blood to the liver, where they are converted to bile and excreted. Slows the formation of plaques, reduces the risk of myocardial infarction, heart attack, by almost half. Speeds recovery after a heart attack, reduces symptoms of coronary artery disease such as angina. Again, when you read these, regular to moderate exercise, when you read these, I want you to think about those people who are sitting in front of the TV doing nothing. It's important. It's crucial that we keep our bodies pressurized for optimal health. Okay. The cardiovascular response to hemorrhaging. The entire cardiovascular system adjusts to maintain blood pressure, restore blood volume. Short-term elevation of blood pressure. Carotid and aortic reflexes increase cardiac output, which increases heart rate, cause peripheral vasoconstriction. The sympathetic nervous system further constricts arterioles. Venoconstriction improves venous return. Hormonal effects increase cardiac output, increase peripheral vasoconstriction. Shock, short-term response, compensate for blood losses of up to 20% of the total blood volume. Failure to restore blood pressure results in shock. Long-term respiration of blood volume. Long-term, did I say respiration? Long-term restoration. Restoration, not respiration. Long-term restoration of blood volume. Recall of fluids from interstitial spaces. Aldosterone and ADH promote fluid retention and reabsorption. Thirst increases. Erythropoietin stimulates red blood cell production. Ways to increase blood volume. We said it. They're going to use a chart to show it to you. And you can follow that chart if that's your wish. 3 general functional patterns with peripheral and systemic circuits. Peripheral artery and vein distribution is the same on the right and the left, except near the heart. The same vessels may have different names in different locations. Tissues and organs usually have multiple arteries and veins. Vessels may be interconnected with an anastomosis. And what we're showing you here is an overview of the pattern of circulation. We're coming out the left ventricle, oxygenated blood. As we come out the left ventricle, we're going to go up and supply the upper limb and the brain. We're going to go down to the rest of the system, supply the organs and the lower limbs. Okay, we're going to supply, or we're going to receive oxygenated blood from the lungs following this route by way of the pulmonary veins. The opposite being true with the veins, the venial side of the right ventricle. Blood is going to be moved out of the right ventricle, deoxygenated blood. We're going to go to the lungs as far as the pulmonary unit. We're coming in. We're receiving is what we're doing. Receiving blood from the brain and the upper limb through the superior vena cava. We're receiving deoxygenated blood from the lower limb to the inferior vena cava, which will drop into the right ventricle. And we're sending that through the pulmonary artery to the lungs to be oxygenated. Let me see. Okay, that will do it for this chapter as far as your lecture video. However, remember that you still need to learn the arteries and veins as far as the anatomy, their location, what branches lead to what other branches, etc., etc. That's identification, more lab work than it is lecture work. So I'm going to stop the lecture video here. And but remember, you still have to memorize the arteries and the veins of the body. Okay.